Hello, this is Dr. Stanley Lang. Welcome to this broadcast. And the topic is diabetes, natural treatment. And to answer the question, well, how long does this treatment last? How long is it effective? And so I want to tell a story about a patient that I saw recently that helps to illustrate about how this program works. So I started to see this patient a little less than 2 years ago, and he had been in the hospital because of a bad infection, and that's where he discovered that he was diabetic. So I saw him for the first time shortly thereafter and gave him some options. He had been told he was going to need to be on a bunch of medicine and that he was going to need to follow a particular diet, but we discussed the options that I often give patients, and he decided to follow that program. So I'd like to sort of show you the things that happened to him as part of his effort. So his weight loss is substantial. From when I first saw him, he was 300.2 pounds, and now he's lost 88 pounds in less than 2 years. Now, this is just following the dietary strategy alone, because he doesn't do my exercise program, and that's because he hurts too much. So if he was able to exercise regularly, I think he would be losing even more weight. But I think he's going to be able to start to do that because he's lost enough weight that it doesn't hurt him so much to move around. And he lives far away from a pool, so he can't really go to a swimming pool. So really, he has done all of this simply by following the dietary strategies. Now, in terms of the chemical changes that we can measure, his fasting blood sugar when it was most recently checked was 81. And you can see that the triglyceride and the HDL are as they are. And that ratio is actually less than 1. The triglyceride HDL ratio is less than 1. And what that shows is that he is dramatically reversing his insulin resistance. If it's less than 2, I'm really happy for that person. But having a ratio less than 1 is really fantastic, particularly for somebody that's diabetic. And notice what his A1C is. It's 5.0. Now, he started out at 6.9, so he wasn't like super high, which, most people that are new adult diabetics, their A1C usually isn't real high. But he went from 6.9 down to into the 5s within 6 months of this program. And the rest of this change has been simply by following the dietary strategies. And so we've met every 3 months. We talk about the details. He gets things fine-tuned, and he's very committed to the program. And he's doing things that he did not think were possible because he was so addicted to the things that drove him to become diabetic in the first place. Now, his legs were a mess when I first saw him, and now they're pretty much healed. So he doesn't have any problems with swelling in his legs anymore. He can walk a lot more easily, as I said. And most importantly, he has totally reversed his diabetes. An A1C of 5.0 is really good, and it's better than a lot of people that aren't officially diabetic. So how long did it take him to get from the diabetes to the non-diabetes range? Well, he was there, as I said, in 6 months. But he's just basically been cementing more his changes as he's lost this additional weight, and he's still losing weight. So I want to encourage you that this is a strategy that works for the long run. I have lots and lots of stories like this that patients have been successful in fairly rapidly reversing the blood sugar elevation, but then gradually continuing to make progress over a period of time and sustaining the progress because they feel really good on it. They don't feel hungry. And we have lots of alternatives for them that include things that you would think you would need to give up. So if you would like to have access to the same program that this gentleman has been using, all you need to do is click on the link for a 7-day free trial, and you can have access to that. So I wish you well on your journey. God bless, and have a great day.